Where do ulcers form in the esophagus? Have you ever wondered where exactly ulcers form in the esophagus? Let's dive into this topic and uncover the details. Ulcers in the esophagus, known as esophageal ulcers, are open sores or lesions that develop in the lining of the esophagus. This muscular tube is responsible for carrying food and liquid from the mouth to the stomach. Most commonly, these ulcers form in the lower portion of the esophagus, particularly near the junction with the stomach. This area is especially vulnerable because it frequently encounters stomach acid due to acid reflux. When stomach acid flows back into the esophagus, it can erode the lining, leading to ulceration. Esophageal ulcers are a specific type of peptic ulcer, similar to gastric ulcers in the stomach and duodenal ulcers in the upper small intestine. However, they are located in the esophageal mucosa. The lower esophagus is the typical site for these ulcers, primarily because gastroesophageal reflux disease, or GERD, is the most common cause. GERD causes stomach acid to flow backward, damaging the tissue and resulting in ulcers. Chronic inflammation from GERD, or a condition known as esophagitis, can lead to ulcers that may appear as ring-like lesions or affect longer segments of the lower esophagus. Besides GERD, other factors can contribute to the formation of esophageal ulcers. Infections, such as fungal infections or viruses like herpes simplex virus, can cause ulcers. Additionally, irritants like cigarette smoke, alcohol, caustic chemicals, and certain medications can also lead to ulceration. Even excessive vomiting can play a role in this process. Clinically, esophageal ulcers can cause a range of symptoms. These may include pain when swallowing, chest pain behind the breastbone, and a sensation of food sticking in the throat. Some individuals may experience nausea or even vomiting blood. To diagnose esophageal ulcers, healthcare professionals often use endoscopy. This procedure allows them to visualize the ulcer and take biopsies to rule out any serious conditions, especially if the ulcer does not heal with standard treatment. In summary, esophageal ulcers form in the mucosal lining of the esophagus, most often in the lower third due to acid exposure from reflux. However, they can occur in other areas of the esophagus depending on the underlying cause. Understanding where these ulcers form and why helps in managing peptic ulcer disease effectively. If you suspect you have an esophageal ulcer or are experiencing symptoms, it is essential to consult a healthcare professional for personalized advice and treatment.